heard all the buzz around intermittent fasting. It's popular, it's trending, and the results sound promising. But if you're a woman, you're left wondering, is this actually right for me? Will it harm my health or mess with my hormones? Today, I'm going to dive into that question for you, exploring what makes intermittent fasting different for women, and if it can really work for you. Plus, I will share a tip with you that matter the most. So hit that like button. And I promise you'll walk away knowing exactly how to approach fasting in a way that's right for your body and health. Let's start by understanding the basics. We often think of fasting as one simple practice, but there are many ways to approach it and not all are created equal. For men, fasting is often straightforward, but for women, it's a bit more nuanced. And here's why. Women's bodies are designed with survival instincts that are deeply tied to reproductive health. Imagine this built-in system that's finely tuned to protect and nurture life. When the body senses any form of scarcity or starvation, it's like an internal alarm goes off. Protecting reproductive health becomes priority number one. So if you're a woman diving into fasting, it's crucial to know what works and what doesn't for your unique biology. If you want a complete guide to fast-track your fat loss journey, the Intermittent Fasting Formula ebooks and video guide have everything you need. With powerful insights, step-by-step strategy, and proven tips to ensure success. Don't miss out. Click below to get instant access and start seeing real change. Now, let's break down what happens when you're fasting versus starving because, yes, there is a big difference. Starvation is essentially the body's way of saying, we're in trouble, conserve everything. In contrast, fasting is a controlled practice that can actually make your body more efficient, using fat for energy instead of muscle. When done correctly, fasting gives you a steady energy release, and you feel clear-headed and energetic, not ravenous. And the key difference? Starvation leads to nutritional deficiencies and forces the body to use muscle protein for fuel, while healthy fasting should leave you nourished, not depleted. This distinction matters, especially for women, as a starvation-like state can throw hormonal balance out of whack, potentially impacting menstrual cycles and fertility. This is where the concept of a healthy version of intermittent fasting comes into play. Imagine fasting without sacrificing nutrients, like a well-balanced orchestra, where every instrument has its role. If your meals within the fasting window are nutrient-dense, containing proteins, healthy fats, and vitamins, you're not just surviving, you're thriving. However, if you're simply eating less across the board, creating a low-calorie diet rather than a true fasting regimen, you risk throwing your body into a stressed state, leaving it craving carbs and signaling that survival instinct we mentioned. Think of it as the difference between skipping meals during a hectic day versus intentionally planning your fasting windows with the right food intake. When you're unintentionally undereating, it's like your body is in a constant state of what's next? I need more. But when you plan your meals, making sure they're packed with what your body needs, it's a signal of safety. For women, this balance is essential to avoid endocrine stress and keep hormones happy. Here's a misconception worth addressing. Some people think intermittent fasting is about restricting calories. Imagine trying to stay full on tiny portions every day, thinking that's what fasting is. Not only would you be hungry, but you'd also lack the nutrients your body craves. That's why some fasting methods like the 5-2 method, which involves eating freely for 5 days, and then drastically cutting calories for 2 days, can actually backfire, especially for women. This pattern doesn't allow the body to adapt and can cause the kind of stress that affects hormone balance. The answer lies in consistency and the right approach, not a stop-start method that can confuse your body's systems. So how do you avoid these pitfalls and make intermittent fasting work for you? Start slow and go gradual. Imagine introducing your body to a new routine, like easing into a new exercise program. You wouldn't dive straight into a marathon if you'd never run before, right? Similarly, easing into fasting by gradually extending the time between meals can help your body adapt naturally. And here's a powerful tip: prioritize nutrient-rich meals. Think of it as quality over quantity. You're focusing on meals that nourish every system in your body. If you're intrigued but a bit overwhelmed, here's how to start. Begin with a 12-hour fast, like from 7 p.m. to 7 a.m., and gradually extend that fasting period as you feel comfortable. Work up to 16 hours of fasting, leaving an 8-hour window for eating. I know that sounds like a big shift, but start small, and you'll see that it's very doable. When you're ready to break your fast, the foods you choose are incredibly important. Your body deserves whole, nutrient-dense foods, so focus on high-quality proteins, like organic or grass-fed meats, healthy fats like avocados, and unprocessed carbohydrates like berries and sweet potatoes. Forget the quick fixes or fad supplements. Your health depends on what you nourish your body with, not on magic pills. Consuming high-quality foods provides sustainable energy and supports your body's natural processes, leading to long-term benefits. One of the biggest concerns I hear from my patients is weight gain with age. Women often gain about 1.5 pounds per year in their 50s and 60s. This may sound minor, but it adds up over time, leading to serious health implications. Hormonal fluctuations, reduced muscle mass, and even sleep disruptions all play a role, making it harder for women to lose weight. Intermittent fasting can be a powerful tool in addressing these issues. By helping to stabilize insulin, promoting fat loss, and supporting better sleep and mood, it provides a holistic approach to age-related weight gain. And here's the best part: intermittent fasting isn't just about physical health. Many of my female patients report feeling more connected to their true selves. Imagine the confidence and freedom that comes from finally taking control of your health. This strategy doesn't just transform your body. It can have profound effects on self-esteem, relationships, and overall quality of life. When fasting is done right, women actually report feeling more energetic, experiencing better mental clarity, and even seeing benefits in skin health. Picture that feeling of having a clear mind and stable energy throughout the day, without the constant hunger that traditional diets often bring. By focusing on nutrient density, you're keeping your body fueled and your hormones balanced, making fasting a friend rather than a foe. At this point, you might be asking, but what if I start feeling cravings or fatigue? Is that normal? And this is crucial. Listening to your body is everything. Unlike men, who might be able to push through hunger cues without much consequence, women's bodies tend to send signals when things are off balance. So if you feel consistent fatigue or intense cravings, it might be your body's way of saying, adjust the routine. Maybe try a shorter fasting window or add a nutrient-packed smoothie to your first meal. It's about fine-tuning, not forcing. But let's be clear, intermittent fasting isn't for everyone. If you're pregnant, have chronic health conditions, or struggle with eating disorders, fasting may not be suitable. Always consult with a healthcare provider to be sure it's right for you. For the rest, intermittent fasting can be a life-changing approach. Now, if you're wondering, what if I'm breastfeeding? That's an important question. If you're producing milk, your body needs extra calories and nutrients. Fasting could reduce your milk supply because it requires a consistent intake of nutrients. If you're nursing, it's essential to consult with a healthcare provider before starting any fasting regimen to ensure you're supporting both your health and your baby's need. And remember, the benefits of intermittent fasting extend far beyond just weight management. When approached correctly, fasting can support women's health in ways like improved metabolic function, balanced blood sugar, and even cognitive enhancement. It's not just about what you lose. It's about what you gain: a stronger body and mind. And a final tip is include at least 2 dates in your diet. They're packed with nutrients. For more on their benefits, check out this video.